Do you have knee pain? Today we're going to be talking about the causes of knee pain because we need to determine the cause so we can decide on the treatment. So the knee joint is very complex. It has a lot of components to it. It has a cartilage which is called the meniscus. We have a meniscus on the inside called the medial meniscus, a meniscus on the outside, the lateral meniscus. Each meniscus has two components to it. We have the anterior, the front one, and the posterior, the back one. We also have the anterior and posterior cruciate ligaments that control this movement of the joint. We also have two ligaments that hold the joints from the outside and the inside, and we have the patella with the patellar tendon that holds the two bones of the knee joint. So, as an interventional pain specialist, when I see patients with knee pain, I look at different components. The most important one, the onset of the pain. Did the pain develop acutely, very quickly, over days or weeks, or is it gradual? Second thing, I look for associated symptoms. Is there swelling? Is there limitation in the knee movement? And is there any fever or heat-like sensation in the joint? And the third thing, I look for injury. Was there an injury to the knee joint, if it's a sport injury, work injury, or an accident? Based on that, we draw the differential to the cause of the knee pain. So if there is a swelling or redness of the joint or heat on touch, it's a hot joint, then we look at inflammatory or infection cause. The most common inflammatory causes of the knee joint is gout or rheumatoid arthritis. And of course, infection could be a cause, although it's rare. Based on that, we might aspirate the fluid inside the joint if there is a fluid in the joint, and we confirm the diagnosis and we set the treatment. If the pain is after an injury, a twist injury or a fall, then it's most likely an injury to the ligament or to the tendons. And of course, that can also be accompanied by a swelling of the joint, severe pain. And if the pain is gradual, meaning it's developed over months, it's most likely osteoarthritis pain, degeneration of the meniscus or the ligaments in the knee. So either way, if you have injury or if you have pain that is developed quickly, you should see a physician right away, because the physician should start the treatment, and they might even go to diagnostic workup such as x-rays, MRIs, or even aspiration of the joint. Based on that, they'll determine the appropriate treatment plan. It could be with medication, it could be with splinting, or it could be even surgical consultation. Now, if you have osteoarthritis, which is a gradual pain, you still should also seek treatment. We can treat it initially with anti-inflammatory and bracing of the knee. And if it doesn't work, then we do the imaging, and we might go to interventions such as injection with platelet-rich plasma or stem cell, and at the end could even reach to surgical intervention. Either way, the knee joint is an important joint of the body because it holds the weight of the body, and we should not ignore the pain that is in the knee because it can progress, and we don't want it to get to a point where there is no option but surgical intervention. And thank you.